I'm an executive chef, and I lost my job in February. And I've been blessed to have a career that has taken me all over this country.
54 years old, my wife and I found ourselves without insurance. I've been insured my whole life.
When my husband lost his job, we found we had no insurance at all.
I've been doing other things to create employment for the family. One is I'm an adjunct faculty, I'm a professor for a university where I teach online, but it's part-time, so it doesn't include health insurance.
I can't afford. I'm not going back to the hospital. I just can't afford it. My blood sugars just kept getting worse and worse. I didn't really know because I didn't know how to test it. I just knew I was feeling really bad.
We're on a fixed income. My husband's retired. My first visit there, he worked with me on my insulin adjustment because it was all over the board. I mean, just up, down, up, down.
We've had insurance for 45 years, ever since we've been working.
I've never been in this situation and have never asked for help.
I traveled to 4 different continents on missionary assignments, and when I returned, I had less than $20 in my bank account, but had some very pressing medical needs.
I didn't call or nothing, just knocked on the door because I wasn't too far from where I worked at, and they took me in.
We have a lot of patients who come into the clinic who are making really hard decisions. Do I use what little resources I have to pay my rent or to pay for gas or to pay for my medication? And quite honestly, a lot of times the medication gets cut out when they need to pay for food or rent or something else first, and we understand that.
People come to us with their sick children in a very vulnerable state. No one wants sick kids, and they come to us with a greater need than their own. And we are able to not only meet that need physically, but we have a doctor and myself that are able to sit down and really assess the situation as a whole.
I come from a family of doctors and nurses. Medicine's in my heart. It's my passion is to serve others, and that's why I volunteered the clinic.
I went to the Kingsway church website. I found the volunteer page. Daddy entry was listed, and that was my expertise.
I see patients at University Hospital downtown on the Med Center, and I also teach, when I'm not seeing patients, I'm teaching the med students and residents how to care for patients.
I was able to go to Kingsway Community Care Center and see qualified physicians that not only cared about my physical needs, but they prayed with me. They listened to me, they loved me, and they really cared about who I was.
Just because we're volunteering at the care center doesn't mean that our standards slip or that we practice any differently than we do at our private practices. We hold ourselves to the same standards and we render the same care.
You know, from the very beginning, I felt wanted and needed, and that was so important. I'm still unemployed, but it doesn't matter. I have a job. It's at the care center.
We're probably a little bit more aware of why we're in the profession that we are.
Patients going out with a smile on their face, knowing that they have been cared for, they've been prayed for, and they've been loved on in the name of Christ.
They provide wonderful health care for people who need it, but beyond that, they really show them the love of Christ.
The board of directors of the Care Center are spirit-led individuals who are sold out for Christ.
The way my volunteer schedule works is that I get to be part of a team each month, the same team. We have the same doctor, nurse, and pharmacist, and then I'm a teacher who gets to work as a receptionist.
I enjoy that experience of helping people and working together as a team and making it work for somebody who's struggling.
We all share a common mission and vision, and that's that we want to reach people that are far from God with the gospel.
Our patients are unique. I've had patients that could be your neighbor and they have just hit a rough spot in life.
I never thought I would be in this situation of not having insurance.
We plan on the future becoming insured, but in the meantime, Kingsway's come in and helped us out tremendously.
There were people out there that were going to help me and then make me feel good about myself. It was truly unbelievable. They are wonderful people.
The love, compassion that they shared for me was just amazing. I mean, hugs, prayers, people come up and pray, and I'm like, this ain't a regular doctor's office, you just really, come in and you're a number, but they really, truly loved you and cared for you, and that's kind of my story.
They are very keyed in to knowing what is necessary for any given patient, spiritually as well as physically.
No matter what your skills, no matter your abilities, we could use you at the clinic. In just a small way, in a small amount of time, you can make a great big difference.
Having a patient come up and say thank you just means everything.
We do ask all of our patients to pay. We do have a sliding scale fee. A lot of patients will come back in 6 months, a year after they've been seen at the care center and ask how much they owe. They want to pay their bill. They want to help the care center.
They always walk out, with a huge grin, and they're so thankful.
I don't know where I would be today if it wasn't for Kingsway and their caring.
The need for Kingsway Community Care Center is really growing and may include real neighbors just like yours. And by the way, I'm also one of their patients.
There have been times when patients are literally crying and hugging me that I was able to help them get medications that they simply could not have afforded otherwise.
I had gone 4 months without taking my blood pressure medicine, and they just told me that's not going to happen anymore. We're here for you. We're going to take care of you.
As director of the Kingsway Community Care Center, I'm blessed to be a part of an organization that consists of selfless, dedicated volunteers serving grateful patients, and it's all made possible by generous donors that help us to accomplish our mission. And I invite you, I urge you to become a part of that in helping us accomplish our mission.
I told them there was a special corner in heaven for all of them.